Usually the causes of high indirect bilirubin are hemolysis, because the conjugation takes place in the liver. So after the liver or before the liver, whatever process happens are the reasons for indirect bilirubin high. So hemolysis is one of the commonest reason for indirect high bilirubin. Other reason is Gibbert syndrome or Crigler-Najjar syndrome. So these are all genetic disorders where you have a high indirect bilirubin, which is seen in patient with hemolysis or a genetic disorder. These are common in one. Whereas direct bilirubin can get elevated in the liver disorders, biliary disorders. It can also be elevated in hemolysis, but then more common is indirect bilirubin that. So direct bilirubin causes are usually liver and biliary disorders, and those are more commonly seen in patients also with hepatocellular dysfunction. It can be cirrhosis, it can be liver cancer, it can also be because of the drug induced, it can be because of overdose of the paracetamol. So there are many causes which can lead to hepatocellular damage, liver damage, and can rise to bilirubin. So by and large, we don't see patient any clinical signs if the bilirubin in the blood is less than 2.5 milligram per cent. So the commonest question patients and relatives ask us is that, sir, my patient doesn't have eyes yellow and still you are saying the patient has jaundice, because if the patient has bilirubin less than 2.5 but more than 1.2, which is upper limit of normal, they still will be called as jaundice, but having jaundice, but then that will not be visible into eyes and you will not be able to see a clinical sign called as icterus. So a clinically visible jaundice is when the bilirubin is more than 2.5.